Yeah, thank you very much. My name is Marco Hafner from the RAND Corporation, and this is joint work with colleagues at RAND and from Ferring Pharmaceuticals. So funding for this study was provided by Ferring Pharmaceuticals. And the objective of this study is it's an observational study that tries to examine the relative importance of Nocturia and its associations with a range of lifestyle behaviors and comorbidities, and most importantly, as well as the association with workplace productivity in a working age population aged 18 and above. For the purpose of this analysis, we use a large-scale online workplace survey, which has been conducted in collaboration with the University of Cambridge and the National University of Malaysia across 7 countries, including the United Kingdom, Australia, Singapore, Malaysia, Thailand, Hong Kong, and Sri Lanka. And this survey covers roughly about 120 questions on a large scale of different health and well-being questions. For this analysis, we used the survey waves of 2017 and 2018, and we have, across these 7 countries and 2 years, roughly about 93,000 participants. We use multivariate regression models to investigate association between Nocturia and a variety of self-reported measures, such as lifestyle factors and comorbidities, such as diet, alcohol consumption, the prevalence of chronic diseases such as cardiovascular disease or cancer, different sleep measures. So there's information in the survey on sleep quality and duration, the first unit of uninterrupted sleep, as well as information on daytime fatigue. We also have information on subject well-being, and as a workplace productivity measure, we use the work productivity and activity impairment questionnaire, which basically measures how much working time is lost due to absenteeism and presenteeism. Most importantly, along a set of sleep quality measures, survey respondents also ask how many times a night they have to get up to go to the bathroom. And we find that on average, about 10% of the survey respondents report 2 or more voids per night. There's some variation across the 3 regions of the survey, but they're not statistically significant. We find a difference across the genders and the age. So we find on average that female respondents tend to report more likely 2 or more voids per night compared to men. And this is also, not surprisingly, increasing by age. When we look at some of the factors associated with reporting 2 or more voids per night, similar to previous research, we find that in this working age population, a poor sleep quality is associated with reporting 2 or more voids per night, as well as whether a person has been diagnosed with kidney disease, cardiovascular disease, or cancer. High levels of blood glucose or diabetes is associated with 2 or more voids per night, as well as obesity and different measures of mental health. When we look at the association between reporting 2 or more voids per night and workplace productivity as measured in workdays lost, we find much lower estimates than previous research. So on average, our estimates suggest 2 to 4% of working time lost if you report 2 or more voids per night compared to someone who doesn't. And previous estimates have been looking at somewhere between 20 and 40%. Mainly in our analysis, this is due to the fact that we adjust for a large set of control variables, including demographics, lifestyle factors, comorbidity, as well as measures of sleep disturbance. The table you see here translates this working time lost into work days. Here you see this applies across different age and gender groups. In terms of the interpretation and conclusions for this study, so we hope that this study, which is a really large study, tries to advance knowledge on the importance of Nocturia in the working population. We find that the consequences of Nocturia are partially explained by poor sleep, but even if you control for a lot of factors, there remains a substantial independent effect of Nocturia on work impairment. And if you take this all into account, there's potentially quite a relative negative effect on work productivity. We could have negative consequences for employers and the wider society. Thank you very much.
Please.
Thank you. That was very good. In terms of working days lost, was there a difference by geography rather than the other demographics? I wonder if expectations of working hours or usual hours per week
I mean, yes, there's an average. I think across when we look at the Asian regions, there has been on average they tend to report a higher level of work impairment, and we look at that. I think there's a slightly larger effect for those countries in Asia.
Thank you.
Hi, my name is Shachi. Great presentation, great work. Couple questions. One, the sleep-related measures that you collected were all self-report, I believe. When you asked for the first uninterrupted sleep period, was it reported the next morning, or were the participants required to do it in time when they woke up, document the time that they woke up after they first went to bed?
So yeah, that's a good question. So it's an online survey. You ask employees at a given point in time, and they report on their kind of normal average first unit of uninterrupted sleep. Okay. So it's not necessarily like related to a specific episode of Nocturia.
All right. And second, you said that most of the effect was mediated through sleep, loss of sleep, and possibly daytime impact of loss of sleep. But after you controlled for sleep, Nocturia still had effect on abstinence and impact on work. In your opinion, what mediated that if it was not through sleep?
I mean, I think when you speak to sleep researchers, they would always say, or you talk to them about Nocturia, they will always say, you know, what is the way of causality? Do you have insomnia and then you just meander around at night and then you go to the bathroom, or is it actually Nocturia that might wake you up and then that leads to poor sleep? So this study cannot conclusively say what exactly is the mechanism, but I think even if we adjust for a proxy for potentially insomnia, having like a sleep disturbance indicator, we still find an independent effect of Nocturia, which is potentially still related to a level of sleep fragmentation, and you're just not really, you know, if you have to wake up twice a night, you're just not really refreshed in the morning. So we still think that's probably part of the driver, but we cannot conclusively kind of say exactly where the link in terms of causality is.
You know, were the days lost, were those actually sick days, or a calculation made from the number of naps per day and sick days and a combination of factors? In other words, exactly what does that mean?
Yeah, so we use for this the work productivity and activity impairment indicator, which asks people how much time they on average lose because they're sick, so they have absence days, but also tries to measure presentism. So if they go to work but not really function to the best of their ability, and then you can calculate the share. I mean, it's all self-reported, we have to mention that, and you can calculate the share of relative working time lost due to absenteeism, presentism.
And did the number of Nocturia episodes per night correlate with the number of days that were lost? Like, you know,
Yes.
Let's say for the ones that had 3 and 4?
Yes.
Thank you.